There are four aspects that I find essential to a successful rhinoplasty. The first is the consultation. This is where the surgeon is able to learn from the patient what is going to make them happy. I collaborate with the patient. We do computer morphing software, and I'm learning from them what's going to make them happy. I'm able to advise them and teach them, and we come up with a goal that's going to make them happy, as well as something that's going to harmonize with their face, create a nice natural result. The second is for the surgeon to understand what is the anatomy underlying their nose? What is the reason that their nose looks a certain way? It may seem like every bulbous nose is the same or every hump is the same, but they're very, very different. These few little cartilages over here, these upper lateral cartilages, lower lateral cartilages, and the septum can be very stubborn. Dealing with cartilages can be very difficult. And the cartilages themselves are extremely variable from person to person. So we have to understand why the nose looks that way, because unless we understand why, we can't know what techniques we need to use to change it to get our final result. So that's really the next part. After you understand what the nose looks like and why it looks that way, you have to have the proper techniques. And I'm not talking about open or closed rhinoplasty or preservation. Those are just the general kind of approaches, or using some fancy tool. I'm talking about the little maneuvers within the surgery, and every surgery is just so different. You have to understand where you can manipulate the cartilages. Do you just cut it away in a certain area? Because whenever you change the shape, size, thickness of the cartilage, you're going to get other changes. For example, if I pinch this over here, if this is too round, it's going to pinch in over here unless I support this. There are many instances of things like this. So that next part is having a nice wide array of techniques and knowing when to use them. The last part is not just knowing which techniques and when to use them, but having the ability to do them and to do them well as the willingness. There are many times during surgery where we get to a point where the cartilages may be difficult, and we do a technique and it's not really looking the exact way that we want to. So we have to be able to just say, okay, well, there's another way to try this. It may be a harder technique, it may take more time, but so what? You have to go in and you have to do the right techniques, regardless if they're hard or if they're quick or if they take long. So really, that is the last aspect, to not just have the ability to do those and know that you have to do them, but to actually do them. There are many cases where at the end, I think that I could maybe do a little bit better. I don't hesitate to take my sutures out and sometimes even redo the same maneuver, the same technique, but just a little bit differently. So really those four aspects are: one, the consultation, and this is where the patient's really involved, going back and forth with the surgeon to help explain what they will kind of be happy with as a final result. But the others are really on the surgeon to understand the anatomy, know how that anatomy needs to be changed in order to give the final result, and have the ability and willingness to accomplish that.